We have a trauma-informed system of care for families, and so it's important to have a good understanding of the variety of child maltreatment experiences that could be affecting some of the children that clinicians are working with. And that can include emotional abuse, physical abuse, sexual abuse, and even neglect. And so understanding how those various forms of abuse can present and how that could affect the child both short-term and long-term is really important for providers to understand. Additionally, it's important to understand what to do from the beginning to the end, meaning how to recognize the signs and symptoms that it may be present and intervene and have the child safety issues addressed, to how do you work with the child after those issues have been addressed and they're no longer in an unsafe environment, but they're dealing with the after effects of that. In addition, it's always important to be taking care of our providers. So those folks who do work with children and families who have experienced a lot of trauma are themselves at risk of developing some symptoms of vicarious trauma. So how do you help your own clinicians or providers identify that in themselves, and how does a supervisor or an agency support their clinicians so that they're not experiencing those vicarious trauma symptoms. So the trainings can also provide information about how to manage that as an agency to help manage the potential effects of this work on your providers. For more information on any of these trainings, please feel free to contact Spurwink's Professional Development Center or visit our website at spurwink.org.